بسم الله الحمد لله والصلاة والسلام على نبينا محمد وعلى آله وصحبه وسلم. Inshallah, today our lecture regarding responding to symptoms in pharmacy practice. We will continue on skin conditions and we will discuss dandruff and hair loss. Dandruff is a chronic relapsing condition of the scalp which responds to treatment but returns when the treatment is stopped. داندروف اللي هي عندنا بالعربي بنقول لها القشرة، هي بتأثر في فروة الرأس وهي chronic. it is a chronic condition نتيجة في السكالب، نتيجة للسكيلينج اللي بيحصل. it is occurred due to the scaling that or the turn off of the scalps and respond to the treatments, but it usually returns when the treatment is stopped. The condition usually appears during puberty and reaches a peak in early adulthood. Dandruff has been estimated to affect 1 in 2 people aged between the 20 and 30 years of age. About 50% of that who age between 20 and 30 are affected by dandruff. Dandruff is considered to be a mild form of seborrheic dermatitis associated with the yeast نوع من الفنجل infection اللي هي yeast called Malassezia farfar. Diagnosis is straightforward and effective treatments are available as over-the-counter medication. What you need to know as a community pharmacist to respond well to a patient or a customer that suffer from a dandruff: you should know the appearance of the scalp or the dandruff, presence of scales and the color, the textures of the scales, location, is it in scalp, is air elbows also affected, or the paranasal cleft or others. You should know the severity and the previous history. You should know if there is a cirrhosis. This is an chronic inflammatory condition also may affect the scalp and other parts of the body. You should know if there is seborrheic dermatitis, or also you should know the aggravating factors and medication, and we'll come on this on the coming slides. First, regarding the appearance, dandruff is characterized by grayish-white flakes or scales, قشور, on the scalps, and each scalp as a result of the excessive scaling of the whole scalp or the skin of the scalps. In dandruff, the epidermal cells turn over at twice the rate of those without the condition. Turnover of the epidermal cells هو سريع two times more than the normal individuals. This will result in the scales that appear in the scalp. A differential diagnosis for severe dandruff could be cirrhosis. In the later condition اللي هو في السيروزيس ممكن يحصل اللي هو there is similarities between dandruff and cirrhosis. Both of them having an affect the skin and may affect the scalp and may characterized by scaling and itching. Is the similarities, but there is a differential diagnosis we'll see between cirrhosis and dandruff. In the later condition here, cirrhosis, both the appearance and location would be different. In cirrhosis, the scales are silvery white and associated with red patchy pulse and this is a cirrhosis in which it is a result from immunological problems. It is not contagious, يعني غير معدية. Red bulbs covered with silvery white scales. Painful and sometimes cracks and bleed may occur in the area that affected by the cirrhosis. Similarities, as I mentioned, itching and the scale. This is a dandruff, and this is a scalp cirrhosis قلنا may affect اللي هي السكالب. This is a dandruff. Regarding the location and severity, in dandruff the scalp is the only area affected mainly. هي عبارة عن mild seborrheic dermatitis. While cirrhosis can affect the scalp, but other areas are involved, including the knees and elbows, which are commonly involved, but the face is rarely affected by cirrhosis. Dandruff is generally a mild condition. However, the itching scalp may lead to scratching. والسكراتشنج ده ممكن يعمل لي bleeding، يعمل لي mild infection, which may اللي هو result in break of the skin, causing soreness and possible increase the possibility of infection. If the scalp is very sore or there are signs of infection, repair should be indicated for these individuals. You should know the previous history. Since dandruff is a chronic relapsing condition, there will usually be a previous history of fluctuating symptoms. تزيد وتنقص, fluctuating, increase and decrease symptoms of dandruff. There is a seasonal variation in symptoms which generally improved in summer. Dandruff هي بيحصل لها improvement generally in summers due to the response to a UVB light, وهي الUV type الالترافايولوت type B هي sensitive واللي هي كان have effect on الفنجل اللي هي المالسيزيا فارفر can be affected by this UVB light, but unaffected by a UV type A light. So due to increase في UVB type during the summer, this can lead to اللي هو proliferation and decrease the colonization of المالسيزيا فارفر, وبالتالي كان بيحصل so that improvement can be observed in the patients that suffer from dandruff. The aggravating factors that can increase the symptoms of dandruff, we have hair dye and perms, cosmetics. Both of them are cosmetics that applied on the hair can irritate the scalp, so that if there is an inadequate reasoning after shampooing, the hair can leave traces of shampoo also, causing irritation and itching, and this can aggravate dandruff. Cirrhosis can be exacerbated by drugs such as chloroquine, known to exacerbate the cirrhosis. You should know the medication because various treatments may be already have been tried by the customer or the patient. It is important to identify what has been tried and how it was used, because maybe there is inappropriate use of the medication. Dandruff treatments need to be applied for the scalp and to be left for at least 5 minutes for the best effect for the anti-dandruff treatment. However, if an appropriate treatment has been correctly used with no improvement, so in this case, repair should be considered for the customer or the when to refer the patient that suffer or complain from dandruff. You should refer the patient if there is suspected cirrhosis, if there is a sign of infection اللي هو due to the increase في أو في soreness في السكالب and في signs of infection, you should refer the patient. If there is unresponsive to appropriate treatment, you give the customer or the patient appropriate treatment for appropriate time, and there is no response, you should revert this patient. Dandruff should start to improve. Dandruff should start to improve within 12 weeks of beginning treatment. This is a time scale for the dandruff. After you give the patient or customer anti-dandruff treatment, you should advise the patient to use this treatment for 12 weeks. Then come back for assessment. If there is improvement, it's okay. If there is no improvement, you should refer the patient. The aim of treatment is to reduce the level of malassezia furfur on the scalp. Therefore, agents with antifungal action are effective. This includes ketoconazole, the most effective, selenium sulfide, and zinc pyrithiol, and the coal tar are effective treatment for dandruff infection. The results from studies suggest that ketoconazole is the most and the coal tar at least effective. All treatments need to be left on the scalp for 3 to 5 minutes for full effect. First, we have ketoconazole. The formulation available is ketoconazole 2% shampoo. The treatment should be used twice a week for 2 to 4 weeks. يعني مرتين في الأسبوع لمدة أسبوعين أو 4 أسابيع. After which usage should reduce to weekly or fortnightly as needed to prevent recurrence. مرتين، نكرر تاني، استعمال مرتين في الأسبوع لمدة أسبوعين ل4 أسابيع. بعد ذاك مرة واحدة في الأسبوع أو مرة واحدة كل أسبوعين دي to prevent the recurrence for dandruff. Ketoconazole is not absorbed through the scalp. This is a good property because we need an localized effect, and the side effects are extremely rare. There have been occasional reports of allergic reactions to ketoconazole in some individuals. We have selenium sulfide 2.5% have been shown to be effective and works by reducing the cell turnover rate اللي هو عبارة عن cytostatic having cytostatic effect. The shampoo containing this ingredient, the selenium sulfide, are P products. This according to British P products, pharmacy only medication, can be considered as O2C products, but should be given by the pharmacist. Twice weekly use for the first 2 weeks is followed by weekly use for the next 2 weeks. Then it can be used as needed for the prevention of dandruff. The hair and scalp should be thoroughly washed after using selenium sulfide shampoo. Otherwise, discoloration of yellow, gray, or dyed hair can result. It should not be applied to inflamed or broken skin. What should be washed? Selenium sulfide should be washed thoroughly. يعني otherwise هو ممكن يعمل discoloration للhair by yellow or gray dyed اللي هو color. We have a zinc pyrithiol, and the products that contain this zinc pyrithiol are available as shampoos and considered as general sale list. This is according to British, so that zinc can be found on the supermarkets. Here تعتبر considered as cosmetics. Zinc pyrithiol is effective against dandruff and has a cytostatic effect. It should be used twice weekly for the first 2 weeks, then once weekly as required to prevent a recurrence of. The last product available we have the coal tar. Although modern formulations are pleasant than the traditional ones, but some people still find that the smell of coal tar unacceptable. Who coal tar available for traditional, the earlier formulation, and characterized by unpleasant smell. The coal tar characterized by unpleasant smell. Coal tar cause skin sensitization and is photosensitizer. هو يعتبر at least هو also we mentioned that the coal tar هو the least one of these four products that effective against Malassezia furfur, the causative fungal for dandruff. We have practical points. The first thing that as a pharmacist you should emphasize on continuing of the treatment because may need for more than or for 4 months or more, so that you should emphasize this point. Patients should, need to understand that the treatment will not cure their dandruff permanently, and that is it will be sensible to use the treatment on at least on a less frequent basis to prevent their dandruff coming back. Also, you should emphasize on that treating the scalp, not the hair. It is the scalp that need to be treated rather than the hair, so that the treatment should be applied to the scalp and massage gently. All products need to be left on the scalp for 5 minutes before rising for the full effect for this to be gained from these drugs. Now we'll talk about the hair loss skin condition that also have an OTC medication. There are two types of hair loss. They are alopecia androgenetica and alopecia areata. The first one, here alopecia androgenetica, which is considered as a male pattern baldness, sometimes known as common baldness because it can affect women, is the most common cause of diffusive hair loss. The most common cause of diffusive hair loss here under alopecia androgenetica. From its name, it's related to androgenetica, relating to androgen, testosterone, and the hydrotestosterone. Alopecia areata may be sudden and result in patchy hair loss. The cause of alopecia areata remains unknown, but it's thought that the problem may be due to an autoimmune in origin. Other causes of diffusive hair loss include resting phase of the hair growth cycle that typically lasts 3 months or more, and this is known as telogen evolvia. And the second cause is the hypothyroidism, and the third one, the severe deficiency of protein and iron deficiency. Occasionally, diffusive hair loss is seen after pregnancy, also in chronic renal failure, and with certain drugs and chemical agents. We have drug-induced hair loss, and we'll talk about on this. Alopecia androgenetica may be treatable, but there are currently no treatments that the pharmacy can offer for alopecia areata, which is going to result from an autoimmune disease. Although hair loss has been regarded largely as a cosmetic problem, the psychological effects on sufferers can be substantial, so that a sympathetic approach is therefore essential for you as a community pharmacist, for your patient or for your customer. What you need to know to respond well regarding the hair loss skin condition. You should know the patient or the customer, is it male or female, the history of the duration of the hair loss, and the location and the size of the affected area. Other symptoms we will talk about, an influencing factor, and the medication that the patient tried or the medication already the patient used, because the hair loss, as we mentioned, can be arise from drug induced hair. Men and women may both suffer from alopecia androgenetica or alopecia areata. Alopecia areata can affect people at any age. Alopecia androgenetica is characterized by gradual onset. In men, the pattern of the hair loss is a recession of the hairline at the front or loss of hair on the top of the scalp. In women, the hair loss is generalized. Telogen evolvium اللي هي resting phase that occur 2 to 3 months after significant physical or emotional stress. The rate of the hair loss increases significantly for a period before resolving substantially and returning to the normal. Typically, this can occur following major surgery or illness. The patient after suffering from major surgery or illness can notice that there is increased hair loss due to an increased resting phase cycle for the normal hair growth. You should know the localization and the size of the affected area because this can affect your adjustment to use a medication or not. If the affected area is less than 10 centimeter in diameter, in case of alopecia androgenetica, then treatment may be worthly trying. If the area that affected, area of baldness or hair loss less than 10 centimeter, it's worth trying. You can use the medication اللي هو المينوكسيديل. Otherwise, like, if it's more than 10 centimeter, you should not. There is no treatment is not advisable to be used because no response will be occur in this case. Regarding the other symptoms, coarsening of the hair and the hair loss can occur as a result of hypothyroidism. In case of severe hypothyroidism, it's called myxedema, which is characterized by characteristic thickening of the skin, with other symptoms such as feeling of tiredness, deepening of the voice, and weight gain, and increased sensitivity to the cold. This is myxedema. Also can be hair loss can be associated with this myxedema. Inflammatory conditions of the scalp such as ringworm infection, tinea capitis, عبارة عن superficial fungal infection can cause hair loss، واللي هي نحن عندنا بالعربي في السودان يسموها القوب. Referral would be needed in such cases اللي هو الميكسيديما, hypothyroidism, or in case of tinea capitis. This is the tinea capitis, which is known as the ringworm of the scalp, can affect the scalp. Hair also can affect some parts of the face. In women, excessive bleeding during periods, in case of menorrhagia, excessive blood loss during menstruation, could lead to iron deficiency anemia, which in turn could cause diffusive hair loss or aggravating alopecia androgenetica. Anemia can also result in hair loss or can aggravate alopecia androgenetica. Absent or very infrequent periods are sometimes due to the polycystic ovary disease or elevated prolactin levels, which in both cases can result in alopecia androgenetica. You should know the influencing factor. The hormonal changes during and after pregnancy means that the hair loss is common both during pregnancy and after the baby is born, after the delivery. While this is often distressing for the woman concerned, it's completely normal, and she can be reassured that the hair will grow back and treatment is not appropriate in this hair loss during or after pregnancy. You should know the medication because we have, as I mentioned, many drugs that can lead to hair loss, such as cytotoxic drugs are well known for causing hair loss. Also, the anticoagulant, coumarins, and the lipid-lowering agents such as the clofiprid and the vitamin A in case of overdose, all of these have been associated with hair loss. Such cases should be referred to the doctor. If you suspect that this hair loss is due to the drug induced, you should refer the patient. Other medication include allopurinol, antigout, xanthine oxidase inhibitor, beta blockers, bromocriptine, carbamazepine, colchicine, antigout also, lithium, sodium valproate, and oral contraceptive. All of these can cause drug-induced hair loss. When to refer the patient or a customer suffering from hair loss, if you suspect this is hair loss due to alopecia areata, you should refer because no OTC treatment available for this autoimmune disorder. Suspected drug-induced hair loss, if there is also suspected hypothyroidism, if there is a menstrual disorders, and if there is a suspected anemia, you should refer the patient. Treatment time scale. A treatment with minoxidil may take up to 4 months to show full effect. Here we have 4 months after you give the patient or the customer minoxidil. The patient should refer to you after 4 months of continued treatment to have an effect. Regarding the management, the only treatment license now available for the treatment of this baldness and the alopecia and the genetica, we have minoxidil, which is available as 2% and 5% lotion and spray that is dissolved in aqueous alcohol solution. The mechanism of minoxidil in treatment of baldness is unknown, but هو طبعا we by chance we know that the minoxidil is effective for treatment of baldness because who is أصلا when we use it, firstly we use it as antihypertensive, and we observe it from the adverse effects of this minoxidil that can result in hypertrichosis or excessive hair growth. فبالتالي هو shifted for treatment of for اللي هو baldness. The earlier minoxidil is used in balding, the more likely is to be successful. قدر ما استخدمناه مبكرا في البالدنس قدر ما كان نسبة النجاح بتاعه الفاعلية بتاعته هي عالية. The treatment is most likely to work where the baldness area is less than 10 cm in diameter. وقلنا فعال جدا لما يكون affected area affected baldness area less than 10 centimeter in diameters, where there is still إذا كان كمان also if there is still some hair present and where the person has been losing hair for less than 10 years. إذا كان هو suffer from the hair loss ده less than 10 years ago. If there is more than 10 years who are losing the hair loss for more than 10 years, so that the successful will not be better than if it is less than 10 years. The lotion should be applied twice daily to the dry scalp and lightly massaged into the affected area. The hair should be clean and dry, and the lotion should be left to dry naturally. The hair should not be washed for at least 1 hour after using minoxidil lotion. Irritant and allergic reaction to the alcohol propylene glycol vehicle اللي هي المذوبين فيها المinoxidil sometimes can occur in some individuals. A small amount, approximately 1.5% of the drug is absorbed systemically, and there is a theoretical possibility of hypotensive effect, but this appears to unlikely in practice. هي ما بتحصل actual في البراكتس، لكن هو theoretically لأنه هو anti-hypertensive إذا كان حصل له absorption so that we can نتوقع إنه يكون عنده hypotensive effect. Minoxidil is also known to cause a reflex increase in the heart rate, and this is a theoretical risk of tachycardia and palpitation have been occasionally be reported. So that you should take care if the patient suffer from ischemic heart disease, angina, or myocardial infarction, because this theoretically may increase the anginal attack due to the increase في الهارت rate بالتالي الأكسجين consumption, and so increase the possibility of a heart attack. It is important to explain to the patient that they will need to make a long-term commitment to the treatment should be to be successful. لابد المريض يلتزم بالعلاج لفترة طويلة من الزمن at least for 4 months to have a good effect. Treatment must be continued indefinitely. New hair growth will fall out 2 to 3 months after treatment is stopped. اذا ما استمر ما continued بالتالي الهير new hair that grown can be fall out if the treatment is stopped. Minoxidil should not be used in case of alopecia areata or in hair loss related to pregnancy. That is all. Thank you for listening. Assalamu alaikum wa rahmatullah wa barakatuh.